Hi, my name is Kristen. I'll be your nurse today. I'm going to provide for privacy and wash my hands. To begin, can I please have you state your name and date of birth?
Taylor Harvard 92699.
Good. So I'll be checking the wristband for that. Taylor, do you know why you're here today?
No.
Okay, so what we're going to be doing is a head to toe assessment. Basically, I'm going to start at your head, check your hair, eyes, nose, work my way down, listening to your heart, lungs, bowel sounds, and then just checking over your overall skin for edema. Are you comfortable?
Yes.
Good. All right, so then I would start by checking. I'm going to ask you a couple questions. Can you tell me where you are today?
Kristen's apartment.
And do you know the date?
Wednesday the 13th.
Very good. This is assessing a patient's speech and level of consciousness. Patient is alert and oriented. Speech is clear, and she's answering questions appropriately. By looking at her posture, patient is sitting erect, no visible signs of dirt or soil, and there is no foul odor indicating good hygiene. All right, Taylor, so what I'm going to do is I'm going to start from the top and just work my way down. So checking the hair right now, no lesions, lumps, scabs, there's no parasites, hair is fine but full. I'm now checking the face for symmetry. Okay, can you please clench your jaw? Okay, it is symmetrical. And now I'm going to be checking you for sensation, cranial nerve 5. Can you feel this?
Yes.
And can you feel this?
Yes.
Good. Next, I'm going to move to cranial nerve 7, your facial nerves. I need you to smile, frown, and puff your cheeks, please. Very good. Face has no visible lesions. There is some scarring due to acne. Next, I'm going to move on to your eyes. So what I'm doing is checking cranial nerve 3 right now. It's your ocular motor. I'm going to just kind of shine a light in your eyes. Okay. Good. 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 I want you to look at my pen, please, and follow. Very good. Pearl is intact. Pupils are equal, round, reactive to light and accommodation. Now I'm going to be moving on to cranial nerves 4 and 6. This is following 6 points. If you could please follow my pen. Good. So cranial nerves 6 and 4 are both intact. Eyes are able to move. No shaking or fatigue in the eyes. And lastly, I'm going to end with the optic nerve, cranial nerve 2. This one is a confrontation test. So what I'd like you to do is cover your eye, mimicking mine. Okay, hands straight out. Wiggle your fingers, slowly moving it forward. Tell me when you can see it.
No.
Good. And we're going to do it on the other side. Wiggle your fingers.
No.
Good. Peripheral vision is intact. Now I'm going to assess the nose. So this time I'm looking to see that it's symmetrical and midline. I'm looking inside the nostrils. No visible discharge. Mucous membranes are pink and moist. Now I'm going to move on to your mouth. If you can please open your mouth for me. I'm checking the mucous membranes. They are pink, moist, no apparent lesions. Next, I am going to place this tongue blade on your tongue, and I need you to say ah, please. Very good. So when I do this, I see that I am assessing the glossopharyngeal cranial nerve, making sure that the tonsils are moving up towards the ova, midline. This patient does not have tonsils there, but there is still movement going towards midline. Okay, I'm going to have you open your mouth one more time. I'm going to touch the back of your throat and see if you gag. Okay. Patient has an absent gag reflex. This is testing the cranial nerve 10. It's testing cranial nerve 10, which is the vagus nerve. And then lastly, I'm going to test the hypoglossal cranial nerve 12. I would like you to stick your tongue out, please. Like just move it side to side. Good. Hypoglossal cranial nerve is intact. Patient is able to move her mouth and tongue. Now I'm going to be checking over your lymph nodes. So this is your preocular, postocular, occipital, anterior cervical, posterior cervical, tonsillar, submandibular, submental, and supraclavicular. Lymph nodes don't appear to be swollen. I'm now going to move on to the thoracic and lungs. So first what I'm doing is I'm going to place my hand on both sides. If you could take a deep breath. Okay. There is adequate expansion in the front, but not in the back, and it seems to be good depth. Next, I'm checking her rate, rhythm, or her rate, depth, and the rhythm of her breathing. If you could just take a couple breaths for me. Rate seems adequate. The breaths are not too shallow, but she's also not using her accessory muscles, so that looks normal, and depth looks normal. And the rhythm looks normal. I am now going to, have you had a cough recently?
No.
No, perfect. So now what I'm going to do is listen to her lungs. And we're going to start in the back. All right, just gonna have you take a deep breath for me. Okay. Now I'm gonna listen in the front.
Calm down, it's not a panic.
I'm just gonna lift this a little bit. And if you could please raise your arms for me. Deep breath again. And deep breath. Very good. There's no presence of crackles, rales, or crackles, wheezing. The lungs sound clear bilaterally. I am now going to move on to the cardiac assessment. So at this point in time, I'm going to be listening to your heart sounds. But first, I'm going to check her carotid pulses. And at this time, we check one at a time. Pulse is non-bounding. I would rate it about a 2 or 3. I'm now going to listen to her carotid pulses, and this is where we're assessing for Brute. Can you take a deep breath for me and hold it? No sounds of Brute, swishing, or swooshing. I am now going to be listening to your heart sounds. And we start on the right side, the patient's right side. This is your aortic, pulmonic, Erb's point. Can you spread your breast for me a little bit, please? And then I'm going to have you lift for me, please. This is the tricuspid. And the mitral. And the mitral is also called the apical. Very good. I am also at this time going to identify her pulse points. We have temporal. And we did check her carotid already. Now brachial, if I can just touch right here. Radial. Ulnar. Femoral is in the groin. Popliteal. And this is the dorsal pedialis, in which I actually have to remove the patient's socks. And the posterior tibialis. Yeah. Pulses appear to be equal bilaterally and no irregularities. Next, I'm going to move on to the GI and GU system. At this time, I'd ask you to please lay on the couch. Okay. So what I'm doing now is I'm going to assess her stomach, listening to bowel sounds. We listen first because we don't want to palpate, as I can skew the bowel sounds. Okay, I'm gonna have you just kind of roll these down for me, please. Very good. Bowel sounds are active in all 4 quadrants. I am now going to palpate. Do you have any pain while I do this?
No.
There is no rebound tenderness. Patient does not report any pain, and nothing feels swollen. And upon inspecting, there is no lesions, no distension. Stomach is flat, and again, no pain. So now what I'm going to do is I'm just going to start feeling her skin. I'm checking for temperature. Okay. At this point, I'm checking for edema. No edema present. And nails would be clear, dry, or clean and dry. Checking for cap refill. Okay. Now I'm checking the legs. Skin is warm, moist. This patient would have no nail polish on. We would ask that they were clean, dry. And then we would be checking for a cap refill. Okay. And now I am also checking for edema. No edema present. All right, if you could please stand up for me. And I'm gonna have you stand over here. I'm gonna have you please bend over. At this point, I'm checking the spine. I wanna make sure that everything is aligned. There is no scoliosis, which is the S-curve, no kyphosis, which is the lump back, and no lordosis, which is the concaved back. Okay, you can go ahead and take a seat for me. I also need to test for your accessory cranial nerve. If you could please turn your head to the left and to the right. I'm gonna have you shrug your shoulders. Good. Patient is able to easily move head back and forth, and there is equal strength on each side. Lastly, hold on. Okay. Now so I'm gonna have you put your hands against mine, please. And would you push? Very good. And with your feet, I need you to push. Very good. And that is testing strength. And now I'm going to be going over all of your reflexes. And I have the hammer. So to start, we would start with the biceps reflex, which is right here. Okay, I want you just to go limp for me. Okay. And hold on. And I'm not getting much movement. Then I would also check the triceps. So if you can just kind of let your hand kind of limp. Very good. And we are hitting this. Right there. Okay. Next, we will be checking the brachioradialis. That tendon is right here. And we're looking for movement in the thumb. Next, I'm going to be looking at the patellar. If you could please put your hands together and pull. And this time I'm checking the tendon, which is right about here. And we're looking for movement of the leg. Very good. Next, I am going to be looking at the Achilles. And we're looking for movement. Okay. And then we will be looking at the plantar, and we're going to look for movement here. Okay. Okay. All right. And then last, we would check the Babinski reflex. Okay. No reflex. Okay. All right. So we've checked all of that. I am going to check for tactile fremitus. Basically, what I want you to do, I'm going to feel your back. Can you please say 99 or blue moon?
99.
Good.
99.
Good.
99.
Good.
99.
Okay. So at that time, we're just checking for vibrations. Head. Ears, nose, throat. GIG. Okay. So I'm going to ask you about your bowel habits. Are you having any constipation, diarrhea? Pretty consistent?
Yes.
Okay. And as far as urinary habits, any incontinence, urgency, pain, discomfort?
No.
Very good. I'm going to have you stand up for me. And one last test we're going to do, if I could have you please balance on one foot and balance on your other foot. Thank you. If you please shut your eyes, I'm going to push on your chest. I just want to check your balance. Good. And lastly, I'm going to have you walk towards my door. Heel to toe, heel to toe. This is checking balance. Very good. Okay, you can turn around and walk back normally. All right, and you can go ahead and take a seat. Gait is normal. She has an even stride. No toes are pointed forward. No indication of a limp or any pain or any abnormalities. Lastly, I'm going to check her ears. So, we are going to, first what I'm looking for, I'm going to pull on this. Do you have any pain there?
No.
No? Okay. Opening looks good. No obvious sign of any discharge, no redness, no lesions. Okay, and now I'm gonna go on the other side and do the same thing. We're gonna look inside. Does this pain hurt at all?
No.
No? Okay, looking for lesions, no redness. And now what I'm gonna do is I'm gonna be checking her acoustic cranial nerve. This one is when we're gonna do I'm gonna have you do a whisper test. We already did check your balance, which is another part of the acoustic cranial nerve, which is cranial nerve 8. I'm gonna say 3 words. I would like you to repeat them back to me, please. Car, toy, dog.
Car, toy, dog.
Very good. And crayon, book, knife.
Crayon, book, knife.
Very good. So her hearing is intact, and she's able to hear. At this point in time, are you comfortable?
Yes.
Very good. Is there any questions you have for me?
No.
No. I would then make sure the patient has their call light. I make sure that I wash my hands, and that would complete my head to toe.